to be able to transition to a semi-professional athlete, you know, like I was just truly blessed. And of course, I graduated from university with my degree.
So what is Richard Bobby Polak, the former national coach, doing these days?
I want to help other young people who are interested in basketball. So right now, I'm working with an initiative to provide facilities, indoor basketball facilities here in Jamaica, starting out in the corporate area.
And that's it for another edition of Where Are They Now? Until next week, same time, same place.
The internationally acclaimed On Stage with Winford Williams.
At a new time, Saturdays at 8 p.m. on CVM TV.
So much more than entertainment.
Hey, what I want?
Hi, I am Candy Pang.
What I want?
What a guan?
That I want, pa.
What a guan? What a guan?
What a guan? Mondays, Wednesdays, and Fridays at 8 a.m., 1:30 p.m., and 10 p.m. on CVM TV.
That's a guan, pa. What a guan?
Let's delve deep into the issues. We'll take you beneath the surface.
Greetings and salutations. My name is Orville Higgins, and it's another edition of Fan Central.
Talking to the people at the heart of the top sporting stories. Hear from your favorite sportsmen and women and the administrators who work tirelessly to make it all happen. It's live sports talk.
I've written an entire article.
Yes.
Looking at all the major issues every Tuesday at 9 p.m. It's Fan Central.
Thanks for joining us for CVM News at Noon. It's Monday, June 1, 2026. I'm Amoy Harriet. Up first this afternoon, police are investigating a double homicide in Longwood near Santa Cruz in St. Elizabeth, where two men, including a businessman, were found dead at a car mart on Sunday evening. The deceased have been identified as 64-year-old car mart operator Melvin Blythe, otherwise called Tutu, or Tuta rather, and 34-year-old Rommel Johnson, otherwise called Cutty. Reports said that residents heard loud explosions early Sunday morning. However, it was only after checks were made at the car mart that the bodies of both men were discovered with what appeared to be gunshot wounds. Investigators are now seeking to determine the circumstances surrounding the killings. Now, the Ministry of Health and Wellness is again warning Jamaicans to protect themselves from the effects of Saharan dust currently affecting the island. Health officials say prolonged exposure to the dust particles can trigger or worsen respiratory conditions, including asthma, chronic obstructive pulmonary disease, respiratory infections, and allergies. The dust may also cause skin and eye irritation and can impact water quality. The ministry is advising residents, particularly those with existing respiratory conditions, to remain indoors as much as possible, wear face masks when outside, and use protective clothing and eyewear. Members of the public are also being encouraged to wash their hands frequently, avoid touching their eyes, properly treat harvested water, and keep water used for drinking and food preparation covered. The annual Saharan dust phenomenon typically affects the Caribbean between May and October, with dust plumes generally lasting less than a week. Health authorities are urging citizens to remain vigilant until air quality conditions improve. To other news now, PNP Region 3 Committee Chair Ethne Miller-Simpson says this year's Africa Day observance sparked important conversations about Jamaican identity, language, sovereignty, and the country's African roots. Miller-Simpson says participants reflected on the role of patois as Jamaica's first language and called for greater recognition of the nation's cultural and historical connections to Africa.
Right, so the conversation today has been very dynamic. We started out really having a conversation about the video with former presidents from Ghana, Kwame Nkrumah. But there are so many pieces to it. We looked at sovereignty, we looked at the theme of the African Union, looking at sustainability and looking at water, looking at the environment. We talked about language. We questioned the motto out of many one and recommending, even where it concerns language, that we do need to move a resolution and to take that forward, because many persons who are here tonight recognize that our first language is actually not English. The language of the cradle for us is patois. It is Creole. So it is having those conversations, issues about blackness, revisiting who we are as Jamaicans, but not leaving out our history and our ancestry in terms of our blackness and our connection to Africa.
A major technological evolution is underway within the Jamaica Constabulary Force, JCF, to drastically improve emergency response times and public safety across the island. Speaking on the Force for Good podcast, Assistant Commissioner of Police Gary Francis reveals the upcoming integration of a new technological solution called C5 that will aid in protecting Jamaicans.
Referred to as a C5.
C5,
C5.
yes.
That is about command, control, communicate, computer, and counterintelligence. And this is really about how to integrate multi pieces of technology to make decision in order to inform our field operatives, our police officers out there of what is happening and to make some predictive analysis in order to do our core function, which is really the preservation of life, protection of crime and property, and prevent crime.
Social worker managers from the University Hospital of the West Indies, the Kingston Public Hospital, and the Victoria Jubilee Hospital say many people continue to be abandoned or forced into homelessness and are still living in hospitals. Based on the growing number of these patients, there is additional strain on the already limited space and resources. More details in this report.
A complicated and complex situation of homelessness is how Head of Department of Medical Social Work at the University Hospital of the West Indies, UHWI, Shireen Williams-Hemmings, is describing unusual cases of homelessness affecting some Jamaicans and hospitals across the country. Speaking specifically about the UHWI, Hemmings says there has been an increase in the number of patients abandoned at the hospital by family members. According to her, there has been an increase at the facility since the COVID-19 pandemic, and to date, there are 20 cases at the hospital. These individuals include at least a teenager and elderly people.
So we have 90% senior citizens. We currently have a teenager who unfortunately his relatives have been unwilling to return to hospital for him due to the nature, he is 16, due to the nature of his medical condition. So unfortunately we've had to manage those situations, tending to all aspects of care, social care, financial assistance, you name it.
The medical social worker head says the longest staying patient has been at the facility since 2019.
Unable to, put the patients out on the roads because they do not have any relatives who have comfort to accept them from hospital care, or the conditions under which they were living prior to hospitalization is not suitable for
And despite the dire situation, there seems to be a solution, although that too has its own issues. The hospital is working with the Poor Relief Department of the Kingston and St. Andrew Municipal Corporation KCMC to find a placement for these abandoned individuals.
So over the period, we have been able to have 2 persons placed thus far. It's a collaboration between us and the Kingston and St. Andrew Poor Relief Department. But as you can imagine, they are also servicing other hospitals as well as persons who are living on the streets. So movement has been slow going.
It was explained that several patients have reportedly remained in hospitals for more than 6 years after being medically discharged, highlighting a growing crisis in long-term care and housing support. Health officials say the situation reflects a lack of suitable placements, with some patients unable to leave because of shortages in rehabilitation facilities. The extended stays are straining hospital resources and raising concerns about the well-being and dignity of patients who no longer need acute medical treatment. Marjorie Gordon, CVM News.
In the meantime, amid growing concerns about mental health and homelessness in the corporate area, the Kingston and St. Andrew Municipal Corporation, KCMC, last week brought together more than 35 stakeholders for a critical seminar. The discussion focused on the challenges facing some of the city's most vulnerable residents and the collaborative solutions needed to better support them. We go back to Marjorie Gordon for the details.
The issues of mental health and homelessness are not just talking points for the Kingston and St. Andrew Municipal Corporation. At a recent seminar, the municipality decided to take action following numerous calls from members of the public.
The public has been having this outcry about the homeless population, particularly at Justice Square, Parade, and other popular areas across the city. And the fact that the KCMC is mandated to cater to the homeless population and to ensure that these individuals are cared for, we decided that we're going to take action.
She adds that the participants at the seminar did not just sit and discuss the issues, but decided to take decisive action.
Instead, we have come together, brought together the stakeholders, the main players, persons who can have an impact as it relates to the homeless population. And that is how today's workshop came to play. The workshop took a different format. It was not just discussions, it was solution-oriented.
She says she is pleased with what she calls the overwhelming support.
Persons came prepared. They came, they shared their ideas. We can develop a plan of action coming out of this workshop. And trust me, the KCMC will have tangible outcomes come next year based on the information that was garnered here today from the various experts. It was data-driven, it was innovative, and most of all, it was collaborative.
Marjorie Gordon, CVM News.
Let's head now to a break. Stay with us for a live interview when we come back.
The internationally acclaimed On Stage with Winfred Williams.
At a new time, Saturdays at 8 p.m. on CVM TV.
So much more than entertainment.
Hi, I am Candy Pang.
What a guan? What a guan?
That a guan pa.
What a guan? What a guan?
What a guan? Mondays, Wednesdays, and Fridays at 8 a.m., 1:30 p.m., and 10 p.m. on CVM TV.
That a guan pa. What a guan?
Welcome back to CVM News at noon. Now, today marks the start of the 2026 Atlantic hurricane season, which will run until November 30. Now, while forecasters are for now predicting a below to normal season overall, Jamaicans are being cautioned not to become complacent. Now, it's been just over 7 months since Hurricane Melissa tore through sections of the island, and many Jamaicans haven't yet recovered from the impact of the Category 5 system. Questions are therefore being raised about just how ready Jamaica is for the 2026 hurricane season. Well, joining us now for this conversation are Director General for the Office of Disaster Preparedness and Emergency Management, ODPEM's Commander Alvin Gale. And in a moment, we're also going to be joined by urban planner and public policy expert, Professor Carol Archer. Good afternoon, Commander, and thanks for joining us.
Good afternoon. Thank you for having me.
Talk to me. At this point in time, can ODPEM say that Jamaica is ready for the 2026 season? And if so, what evidence can you point to for us as Jamaicans to say, yes, this is how we know that we're confident in your assessment? You're confident in your assessment?
Well, what I say, the national system is definitely ready to take on the challenges of managing any emergency that should come our way. We sort of looked at it against maybe 8 or so pillars. In terms of a clear command and coordination role, looking at the reliability of our early warning systems, looking at operational readiness, critical infrastructure protections, and also the matter of continuity of governance matters, and also just overall recovery readiness. Based on our assessments, we do believe that the national system is operationally ready and also response capable. Notwithstanding, there may be a few areas that we need to target for improvement, but we do believe that the national system is ready to respond to and manage any disasters that may come our way during this hurricane season. Not only hurricanes, as we're planning for multi-hazard scenarios, but we are indeed prepared.
What, if any, weaknesses were identified during Hurricane Melissa that ODPEM has addressed over the past 7 months since we had the hurricane?
Sorry, I missed the question. Could you go again, please?
What weaknesses did you identify during Hurricane Melissa that ODPEM has sought to address over the past 7 months, if any weaknesses at all?
So one of the things we are concentrating on is using more technology within our National Emergency Operations Center. While it's not necessarily a weakness per se, what we have realized is that integrating technology into our information process flow will cause for us to be able to make decisions on a quicker timeline, but also having greater information at our fingertips would cause us to have data-driven decision making right up from the parish levels all the way through to the policy level. That is important for us. We're also looking more squarely at how we'll treat with getting information out to the affected populations. One of the things we did notice during Hurricane Melissa is that, the eastern parishes were able to hear us very clearly through our press briefings and so on, easy for them to get the message across to. But the persons in affected parishes, there was some struggle, there was some delay because they didn't have the ready access to light, internet, and so on. So we're looking at those gaps and fixing them through what we call, multimodal means of communication to those so affected. So we're looking prescriptively at that, and we think we'll be better able to monitor that and pass information through this disaster or through this hurricane season rather.
Commander Gale, God forbid, if Jamaica was to face a direct hit from a major hurricane tomorrow, Tuesday, what's the greatest operational challenge ODPEM would have to overcome?
Well, the greatest operational output for us. Wow, it's very hard to think of a hurricane coming tomorrow. I will say it really depends on the scale of the operations. Melissa for us was a really large event. Our ability to scale up the national system to the size required may be our greatest challenge, but we have put systems in place. We do have the Jamaica Defense Force, the Fire Brigade, the Jamaica Constabulary Force as our boots on the ground. So we do have those operational elements ready to give an effect to any disaster recovery response mechanism that we need to put on the ground.
Commander, you spoke just now about some of the things that ODPEM is doing right now ahead of the season has begun, but going into the season further. And what we see a lot of, which by the way sounds like ODPEM is being proactive, but one of the concerns, especially that we've been hearing since Melissa, is that perhaps government policy makers, the authorities have been a bit too reactive. What's your response to this school of thought that we're not doing enough to reduce disaster risk before storms hit, but instead we're choosing to do most of the work after the damage is already done? What's your response to that school of thought?
I do believe, from my own perspective on the organization, that significant work has gone into causing for some mitigation efforts to occur. Definitely, if we look at how we've been preparing, so for example, if we look at pre-positioning of items, I think if we look back at the record, this was one of the things that we were praised for, if we put it that way, in terms of how we looked at the Melissa event. That's not a rapid onset event, so we had some focus time to put items in key places before the hurricane hit, and that would have enabled critically the quick responses on the ground. Notwithstanding, Melissa was a Category 5 event and quite a large event. 6 or 7 parishes in Western Jamaica were affected. So notwithstanding our ability to pre-position, moving from where the pre-position elements were into the directly affected spaces was also impacted.